Welcome back to TV5 News at 9. It is time now for Medical Moments with Covenant Healthcare. Joining us this morning is Dr. Vinu Malhotra. Thank you so much, Doctor, for joining us today.
Good morning, Colette. It's my pleasure to be here.
Thank you. Today we are talking about personalized cancer treatment. So tell us a little bit about that and why this is better for patients.
So, Colette, personalized cancer treatment, as the name implies, the treatment is targeted towards a specific cancer cell type. I'll give you a little background. Cancers were classified originally based on the organ of origin, lung cancer, colon cancer, breast cancers. And then we subsequently subclassify those cancers based on the cell type. How does the cell look like under the microscope? Now we have the ability to further understand the pathophysiology of these cancers. We can identify the receptors on the cell wall. We can sequence the DNA and the RNA and therefore identify the specific driver mutations in the DNA that is resulting in the proliferation of these cells. If we can identify such a driver and have a treatment targeted towards that driver or that culprit, then the responses are a lot more durable. So we have much better chance of getting a response to the treatment. And if we get a response, the responses are a lot more durable and the treatment is better tolerated. So for a variety of reasons, personalized treatments are way better than the plain old chemotherapy that we had been using for many years. And don't get me wrong, chemotherapy is still the backbone of a large variety and majority of cancers, but we are improving our ability to personalize care.
So tell us about immunotherapy. Tell us what that is, first of all, and is that a type of personalized care?
Yeah, so immunotherapy is a class of drugs that is able to ramp up the immune system of the body. In other words, we are removing the brakes from the immune system and letting the immune system go and attack the cancer. So recruiting the body's own immune system to attack the cancer. The reason it's better because now the immune system has memory and therefore the responses last longer and we can live longer with immunotherapy. Many cancers like metastatic melanoma, 7 years ago or 8 years ago, that was considered incurable. And now we have people in remission for over 5 years. We still don't use the word cure for metastatic disease, but I think that is a realistic goal at this point with the advent of immunotherapy.
Now, should patients expect treatments to be tailored to their specific disease?
Absolutely. Anytime we are treating a cancer, our goal is to classify the cancer as best as we can and identify a target. If we can identify a target, that improves our ability to treat that disease. So yes, that is always our goal, to identify a target and personalize the treatment. In the absence of such a target, we still resort to our standard of care treatments and chemotherapeutic approaches.
Now, is this something that patients should ask their doctor about?
Yes, they should, and I believe any qualified professional treating cancers will look into this and will definitely attempt to personalize the treatment.
Anything else we haven't covered that you think is important when it comes to personalized treatment?
With respect to personalized treatment, you should ask for it, make sure that it's being done, and as I said, all of us in this field do our best to sequence the DNA and personalize the treatments. And on a different note, screenings, identifying the cancer early still remains the best strategy to catch it early and have it cured.
Early screenings and prevention. Thank you, Doctor, for joining us this morning.
Thank you, Colette.
You're welcome. And if you have any other information or any questions, we do have additional information on today's topic. Just head on over to the hot links page on WNEM.com.